Is buspirone safe during pregnancy? When considering the use of buspirone during pregnancy, many people wonder about its safety. Buspirone, often known by the brand name Buspir, is a medication commonly prescribed for anxiety disorders. For those managing post-traumatic stress disorder, or PTSD, effective treatment is vital, especially when anxiety symptoms can be severe. It is essential to weigh both the potential benefits and risks of using buspirone during pregnancy. Current scientific evidence regarding the safety of buspirone during pregnancy is limited but generally reassuring. A significant study followed a small group of women who took buspirone during the first trimester. Among these women and their infants, no major malformations were observed. This suggests that buspirone does not seem to increase the risk of major birth defects in this group. However, it is important to note that the sample size was small, and more research is needed to confirm these findings and to identify any rare risks that might not be evident in a limited study. Untreated anxiety and PTSD can also pose risks to both the pregnant individual and the developing fetus. Chronic stress, insomnia, and emotional distress can negatively impact pregnancy outcomes and overall well-being. Therefore, the decision to continue or discontinue buspirone during pregnancy should always be made in consultation with a healthcare provider. Stopping medications suddenly can lead to a return of symptoms or withdrawal effects, which may also affect pregnancy. There is no evidence that buspirone affects fertility in women or increases the risk of birth defects beyond the background risk. However, individual responses to medications can vary, and the potential for rare side effects cannot be completely ruled out due to the limited amount of data available. In summary, buspirone does not appear to be associated with a higher risk of major birth defects based on current research. However, the available data is limited, and more studies are needed to fully understand its safety during pregnancy. For individuals with PTSD or anxiety, it is crucial to discuss treatment options with a healthcare provider to ensure the best possible outcomes for both parent and baby. Personalized medical advice is always recommended, as each situation is unique and requires careful consideration of the benefits and risks. If you are pregnant or planning to become pregnant and are taking buspirone, do not make changes to your medication without first consulting your healthcare provider. They can help you make informed decisions based on your specific needs and circumstances.